Dr. Sarah, is breakfast cereal healthy?
Yeah, absolutely. We have this big 2022 meta-analysis that was looking at how ultra-processed food consumption affected health. And very specifically, trying to figure out if it's all ultra-processed foods or just some types of ultra-processed foods. And their data with cereal was fascinating. What they showed was that the people who ate the most breakfast cereal had a 15% lower risk of all-cause mortality, which is an indirect way to measure overall health and longevity, compared to the people who ate the least breakfast cereal. And that was looking at all cereal, from oatmeal and all bran to fruity pebbles and Cocoa Puffs. When they further divided cereal into whole grain breakfast cereals and sugary breakfast cereals, fascinatingly, they showed that people who mainly ate whole grain breakfast cereals had a 23% reduced risk of all-cause mortality, again, compared to people who don't eat much cereal. And the people who mainly eat sugary breakfast cereals had overall no change in mortality risk. So sugary breakfast cereals are health neutral, and whole grain breakfast cereals are health promoting. Now, some of the reasons for these benefits. Cereal is a main source of fortification, so for many people, that's where they get their B vitamins and their iron. Whole grain breakfast cereal tends to be a great source of fiber, but also just eating breakfast is an incredibly health promoting habit. Eating breakfast, no matter what we eat, is beneficial. For example, a 2019 meta-analysis showed that people who ever skip breakfast have a 22% increased risk of developing type 2 diabetes compared to eating breakfast every day. And in their subgroup analysis, they accounted for age, sex, smoking, alcohol intake, total energy intake, BMI, family history of diabetes, physical activity, and education. And they showed the more often you skip breakfast, the higher your risk of type 2 diabetes. Skipping breakfast 4 or 5 times per week increases risk by 55%. And in a different 2019 meta-analysis, people who regularly skip breakfast had a 21% increased risk of cardiovascular disease and cardiovascular disease mortality compared to people who eat breakfast every day. And people who regularly skip breakfast have a 32% increased risk of all-cause mortality compared to people who eat breakfast regularly. And this study's statistical analysis accounted for age, sex, race and ethnicity, marital status, family income level, smoking status, alcohol intake, physical activity, total energy intake, a healthy eating index as a measurement of overall diet quality, body mass index, whether or not they had hypertension, diabetes, and high cholesterol. And they did additional analyses that accounted for even more variables, including how much people walk, how much they sleep, how many servings of vegetables they eat every day, how much dietary fiber they get, perceived mental stress, whether or not they live alone. You name it as a confounding factor, this study probably accounted for it in their statistical analysis. The reason why breakfast is such an important healthy habit is that it helps to regulate our circadian rhythms and our HPA axis, meaning our stress responses. And while there are definitely more nutrient-dense, balanced choices for breakfast than breakfast cereal, studies show that cereal is still a health-promoting choice, especially when it's a whole grain breakfast cereal.